This is part one of our body composition lecture and its application. The study of the components of the body and their relative proportions is the definition of body composition. The relative proportions are of our fat and fat-free tissue within the body. The combination of this is expressed as our total body fat percentage. Sometimes fat-free is also referring to fat-free mass, which can be abbreviated as FFM, and fat mass is sometimes abbreviated as FM. The measurement of body composition evaluates and predicts health risks for disease. This is our percent body fat and distribution of fat. Other measurements include body segment girth and bone mineral density. When talking about percent body fat, it's sometimes abbreviated as PBF. The percent body fat is an assessment of fat. This is within the children, adults, special populations, and older adults. Knowing our percent body fat can have different benefits. If somebody has excess fat or obesity, they have an increased risk of type 2 diabetes. Type 2 diabetes can occur in any population. Why we want to know about type 2 diabetes is that it can cause increased different conditions. These include metabolic dysfunctions such as hypertension, which is high blood pressure, dyslipidemia, CVD. Increased body fat or excess fat can also indicate increased morbidity and mortality. Certain types of cancer are more prevalent. It increases our mechanical stress on the body, as well as osteoarthritis, which is due to the pro-inflammatory mediators activated by increased adipokinesis and cytokines. The prevalence of obesity has increased over the last few decades. When we're talking about adults, we're talking 18 years old and older. In the current US population, approximately 35% of adults are classified as obese, and 17% of children are classified as obese. Body composition measurements are important across the board. It's not just knowing obesity or not. It's appropriate to evaluate body comp in low and high individuals. Females with low percent body fat are susceptible to low bone mineral density, osteopenia, and osteoporosis. We also, as females, need to maintain a minimum body fat percentage and also, or in order to have normal hormonal and menstrual cycles. Older adults with low fat-free mass can yield sarcopenia, which is loss of activities of daily living. It can create exercise prescription, baseline and post-intervention by knowing our body composition measurements. Cachexia, or loss of muscle, so we can establish a healthy and unhealthy weight loss. And for athletes, BMI can be off, and it's also important for our weight-sensitive sports and can catch signs of malnutrition. When we're talking about weight-sensitive sports, that can be sports where weigh-ins are required, like wrestling, but it also can include sports where the perception of a specific body mass can lead to specific results. For example, track athletes who think that they need to be lighter to be faster. The same can be said about swimmers. It's also important for our body conscious athletes, our more performative athletes, where body type is more criticized. So that can be gymnastics or cheerleading, things like figure skating. Wrestling can also fit into that category. So it's important that we know how to take appropriate body composition measurements in various different populations, because body composition is just a data point. It gives us information to be able to look further. There are several different methods we can use to measure body composition. Some of these require more equipment than others, and we'll talk about those in the future slides. But our different methods of measurement include BMI, circumferences, specifically of a limb's girth, usually, our waist to hip ratio, hydrodensity or hydrostatic weighing, skin folds, bioelectrical impedance analysis, air displacement, ultrasound, dual X-ray absorptiometry, or MRI and CT scans. When we're looking at different body composition measurement methods, currently the gold standard is hydrostatic weighing. This is the gold standard to determine body fat percentage. Hydrostatic weighing is looking at our body volume and then using water displacement to determine it. Other options are MRI or CT. This can be used to examine fat and fat-free mass. It is very costly, and you can usually only do one segment at a time. So when we're talking about segment, we could look at the lower leg on one side, and then we would need an MRI to look at the upper leg on that same limb, and then we'd need another MRI to look at the opposite side, lower leg and upper leg, and so on. This can be very costly. We also have the dual energy X-ray or DEXA. This is usually a test for osteoporosis, which is also for bone density. It can test regional body fat proportions, which is nice. We can look at the different proportions between like the upper body and the lower body, or one limb to the other side. However, there are risks to DEXA. It is costly, and we are also exposing the patient to the radiation of the X-ray. It's very low levels, just like any X-ray, but it's not something that we want to do super often. Ultrasound is another measurement method using imaging ultrasound. So a little bit different than what we think of as like therapeutic ultrasound. For those of you that have like been in a physical therapy clinic and have used an ultrasound, that's different. We're talking about imaging ultrasound, similar to what we see when we're looking in pregnant individuals and trying to get an image of the baby. We can use that same technology on other body segments, and we're able to measure the different layers of the tissue between our fat and our fat-free mass. But again, costly. Usually we need to capture images and then go back and measure them at a later time. And only certain segments can be examined at once. When we're using any kind of ultrasound, it's just using sound waves through a transducer and some sort of aqueous medium. That's why we need the gel. We also have air displacement, which is most commonly our BOD pod. Those of you that have had ex-phys have seen the BOD pod. The BOD pod measures the body volume by assessing air displacement. So similar to the hydrostatic weighing, where we're looking at water displacement, the BOD pod is assessing air displacement. And then we also have bioelectrical impedance analysis, where an electrical current flows through the body and it is measuring the resistance of how long it takes that electrical current to get from one point to another. Our different tissues conduct that flow at different rates. All of the measurements on our previous slide require equipment, and that equipment can vary in price and availability. Something like a biometrical impedance is a lot cheaper compared to the rest of them. However, you can't just get a BOD pod and place it anywhere. You need to have the space for it. You have to have the training in order to conduct it appropriately. Same with hydrostatic weighing, very specific piece of equipment. Here we're talking about our more anthropometric measurements. These usually require less equipment, less high-tech equipment, and less specific training. So these measurements include our BMI, which we've spoken about in previous lectures and also previous labs. We also can do circumferences. So that's measuring something like the girth of our thigh. Okay, so we might measure 5 centimeters above the top of the kneecap and then measure the circumference. When we're taking circumference measurements, it's best to be used when we're looking for changes within that body part. So this is something that's very common at the beginning of a fitness program. Take circumferences and then take them again, maybe 6 or 12 weeks later to see if we have any change. We have our waist to hip ratio. So for our waist to hip ratio, we're looking to see what the measurement girth difference is between our waists and our hips. So we'll talk a little bit more about how to apply that, but our waist to hip ratio, we measure our waist near our umbilicus or belly button, and then we're going to measure our hips at the thickest part of our body, including our gluteals. We also can do skin folds. So skin folds use our skin fold calipers in order to pinch the skin, which can estimate our body fat percentages. However, we do use the assumption that the amount of subcutaneous fat is proportional to the total amount of body fat by taking these subcutaneous fat measurements within different locations of the body. On these next few slides, we're going to talk about the advantages and disadvantages of some of the different measurement strategies. So the first one is BMI. So BMI, the advantage is that it's very easy to perform. All we need to know is the patient's height in meters and their weight in kilograms, and then we just plug it into the equation, which is their mass divided by their height squared. However, BMI measurements are more accurate for overweight individuals and less accurate for some thinner individuals. Some disadvantages of BMI is it doesn't show adipose tissue distribution. So we don't know how that tissue is, or that fat mass is distributed within the body. We just have an overall number. It often overestimates the value for muscular individuals. Why that is because we know that muscle weighs more than fat, right? A pound of muscle and a pound of fat don't have the same volume in our body. And so if we're just using height and weight to determine our BMI or our body fat percentage, it doesn't give us the whole picture. And then also the biggest disadvantage for BMI is that it doesn't actually give us a body fat percentage. It just gives us a classification. So another option is our circumference measurements. So some of the disadvantagements of taking circumference measurements are technician error. So not having the tape measure perfectly straight around a circumference. It might dip a little bit lower in some places than the others. So we're not able to get the most accurate reading, people not reading the tape measure appropriately, people not measuring in consistent spots using specific landmarks. Another disadvantage is because of some of these errors, it's not usually used for research or medical reasons, and it's only going to measure our subcutaneous adipose tissue. So it's not going to measure like visceral adipose tissue or things like that. Some of the advantages, though, are it provides us information on the distribution of fat. That's if we take multiple circumference measurements, which we would do. So if we're measuring the thigh and the calf and the abdomen and the waist and the upper arm, we can see how that fat is being distributed. Another advantage is that it's easy. All you need is a tape measure and a way to record. It's inexpensive because all we need is a tape measure. It's non-invasive. This is a measurement that we can often do over clothing as long as it's not super baggy clothing. And so we could take lower body measurements with our patient in leggings or a t-shirt, things like that. It also can predict body fat, percent body fat within a range of 2.5 to 4% accuracy. So every measurement type has error associated with it, but our error for body fat percentage is only 2.5 to 4.0%. Also, the combination of looking at waist circumference and BMI together can be risk factors for cardiovascular disease. So we know that people that tend to have a higher waist circumference in addition to a high BMI are at greater risk for our cardiovascular diseases. So this table just shows us that relationship between BMI and waist circumference, and then their tiers for risk factors. So if we look all the way to the left, we have a BMI of less than 25, a BMI between 25 and 30, and a BMI over 30. And then we can see the waist circumferences and what their risk factors are. This specific graph is specific to males. So remember, that gives us our standard deviation with our means. So different sources use slightly different positions to determine where the waist circumference should be. It got a little bit cut off, but some say immediately below the lowest rib. Now, some people forget about our floating ribs of 11 and 12, so sometimes that's a little bit hard to find where that lowest rib is unless we're looking appropriately from the back. The ASM says the narrowest point of the waist. The WHO says the midpoint between our lowest rib and iliac crest. And the NIH says to measure immediately above the iliac crest. So there is some discrepancy. That is why it can be a little bit hard to figure out waist circumference or waist to hip ratios if we're looking at the literature overall and looking to see a consistent research application, is because different individuals use different criteria. Moving on from circumference measurements, we're going to talk a little bit about the advantages and disadvantages of hydrostatic weighing. Some of you may have done hydrostatic weighing or seen a lab. I think it's included in your ex-phys class. Some of our disadvantages are it's really expensive, right? We need the weighing pool. We need the device that lowers them. We need to be able to measure. It's expensive. It's also difficult for the participant. You have to be able to expel as much of your lung volume as possible. There can be technician error, and you need to measure residual lung volume for accuracy, right? So how hydrostatic weighing works is you weigh the participant before having them enter the water, and then you're going to measure the loss of body weight when they're fully submerged. But it's highly influenced by the amount of air trapped within the body, or our residual lung volume, and gas in the GI system. Residual lung volume should be measured, but it's often just predicted because it's very hard for somebody to expel all of the air within their lungs. GI gas is not really able to be calculated very effectively between different participants, so it's usually calculated at a constant of 100 milliliters. There are equations that can be utilized to estimate residual lung volume. Some of the really big advantages of hydrostatic weighting is that it uses Archimedes' principle of body density and considered the criterion method. So remember, this is considered our gold standard, but it might not be appropriate for all of our patient populations. Moving on to skin folds, some of the advantages of skin fold measurements are that it can predict percent body fat. It also can show us our fat distribution because we're taking that skin fold measurement at different parts of the body. It's also fairly inexpensive. You can buy skin fold calipers for around $35, right? They're not super expensive. Now, different calipers, they're different quality and levels, like all things. And once the spring is not working as well, they do need to be replaced. Some of the disadvantages are technician training is required. You need to have the correct skin fold location and angle, and it can be a little bit uncomfortable for the client or patient. Another big component is that hydration status may influence the results because the amount of water or hydration that we have in our bodies can affect the elasticity of our skin, and we need to be able to know a little bit about how hydrated somebody is because we might get slightly different pulls when we're doing our skin fold based on that. Biometrical impedance is another one of our analysis tools. One of the biggest disadvantages is that hydration status can significantly impact our results. So when we're doing biometrical impedance, it's measuring how quickly or how much resistance this electrical impulse has as it's traveling through the body. We know that the current flows more readily through water, so your hydration status could affect the amount of resistance or the time of that measurement. It can be expensive depending on the device. If we're looking at the pictures here, the device on the left is more expensive than the device on the right. Some of our advantages are that it's non-invasive, right? So we just hook up these electrodes or we have the patient hold the device and then it's measuring that current, and it is pretty easy to use. However, that's easy to use for the clinician and not necessarily for the client. Even though it's not invasive, we do want the client to take certain steps prior to the assessment. So those include no alcohol consumption for 48 hours prior to the test, no products with diuretic properties for the previous 24 hours. One of the biggest diuretic properties that people do are drinks with caffeine. So trying to tell somebody not to drink any caffeine for a full 24 hours before the test, you may or may not get compliance with that. We don't want our patients to exercise for the previous 12 hours before the test. No eating or drinking for the previous 4 hours, and the bladder should be voided completely within 30 minutes of the test. So we want to make sure that they're urinating within 30 minutes of the test. These different systems can range in price points. So the one on the right might be affordable, the one on the left maybe not. So when we're looking at the BOD pod, there are also advantages and disadvantages. One of the big disadvantages is the cost. It's very expensive. You also need a controlled environment for the equipment, and you're also not accounting for residual lung volume. That is where things differ a little bit from the hydrostatic weighing, does take into account residual lung volume. So because we're looking at displacement of air, residual lung volume and GI volume can have an impact, or GI gas. Advantages of the BOD pod, it's quick and comfortable. You get in there, it takes 1 to 2 minutes, and that's it. It's also non-invasive, so you go in there clothed. We're not poking and prodding our individuals. And it can be measured for people with disabilities, right? You're sitting in the BOD pod, so people with all different ability types are usually able to complete this assessment pretty easily and painlessly. When looking at the use of ultrasound, some of the biggest disadvantages are needing a skilled technician to administer and interpret the data. There's also not a lot of standardization for the techniques, which can give different results. Some of our advantages are no radiation, unlike things like our DEXA, and it's quick and non-invasive. So you can pretty quickly apply the transducer, get the imaging, capture the images, and move on. Lastly, we're going to look at our advantages and disadvantages of the DEXA. So the biggest thing with the DEXA is that it's pretty comfortable for patients as long as they're able to lay for the amount of time required for the test. It also correlates highly with underwater weighing or hydrostatic weighing, and it can give you a bone mineral density amount, which is unique to this type of assessment. Bone mineral density is usually the primary indicator for DEXA. It's also really common for oncology patients. Some of the disadvantages are the cost. It's very expensive. It's basically a full body high-tech x-ray. So because of that, we also are exposing the client to radiation, and tall individuals can't fit in the boundaries of the testing device. It also requires a physician's prescription, and it's not portable. We have very similar disadvantages for our CT and MRI as well. MRI does not require radiation, but it is expensive. It requires a physician prescription. It's not portable. Same with a CT, not portable and does require a prescription. Body composition in children and adolescents can predict cardiometabolic diseases and premature mortality. It can also be used for early interventions. Skinfold equations have correlated well with DEXA scans looking at bone mineral density. Can you think of any other methods that may be appropriate for children and adolescents? As we've seen, there are a lot of different ways to collect and interpret our body fat percentage estimates. There can be a trifecta of complications. The lack of established and accepted universal standards for body fat when we're trying to extrapolate this to different populations is the biggest issue or complaint. So we can have a lot of tools to know what our body fat percentages are, but then how we use that data can be problematic. When we're talking about minimum body fat percentages, females need to have a minimum body fat percentage of 12%. If they have less than 12%, this can cause hormonal changes and lead to the absence of menses. This can put them at higher risks for things like female athlete triad, which is usually loss of menses, disordered eating, and low bone mineral density or osteoporosis or osteopenia. For our males, the absolute minimum we could have is 3%. And that's because if we go below 3%, males can lose internal organ protective padding. So we need a base layer of visceral fat to protect our internal organs. When we're looking at different methods for body fat percentages, all the methods have a standardized error associated with them. Skinfolds have approximately 3 to 5% error when we're comparing the skinfold measurements to the hydrostatic weighing. However, we also know that hydrostatic weighing has its own error. So that 3 to 5% of skinfold could be as high as 8 to 10%. There's no universal accepted criterion method. So as of right now, hydrostatic weighing is still considered the gold standard, but like we've talked about previously, there is some error associated with that. The only differentiating factor when we're talking about body fat percentages and minimums is gender. Again, females should not be below 12%.